Hi, I'm Angela, a medical surgical telemetry nurse, and these days, someone living with a triple-negative breast cancer diagnosis, myself. Before all this, I was the nurse telling patients a little movement will help you feel better, and I believed it. Now, as I get ready to start my own treatment, I've been thinking a lot about how different that advice feels when it's your own body on the line. So let's talk honestly about movement and energy, what cancer-related fatigue actually is, how to move safely while you're in treatment, and how to rebuild your strength once it's over. First, let's name what we're dealing with, because cancer-related fatigue is not the same as being tired. Regular tiredness gets better with a good night's sleep. This doesn't. More than 8 in 10 people getting chemo or radiation experience it, and it can show up even after minimal activity. It comes from a mix of things: the treatment itself, anemia from a lower red blood cell count, pain, poor sleep, and the emotional weight of a diagnosis. Here's the part that surprised me as a nurse. Too much rest actually makes it worse. Spending all day in bed leads to muscle weakness and can tank your energy even further. That doesn't mean push through no matter what. It means finding the smallest amount of movement your body can handle today and building from there.
So what does safe movement actually look like during treatment? Research on exercise in cancer consistently finds it's generally safe and can measurably ease fatigue, anxiety, and low mood. But the goal on a hard day is simply avoid inactivity, not hit a fitness target. If you're wiped out, 10 minutes of light activity counts. Walk for a few minutes, rest, then walk again until you've added up 30. Chair yoga, gentle stretching, and short strolls are all reasonable places to start. Always check with your care team first, especially if you have heart or lung issues, weak bones, balance problems, or numbness in your hands or feet. And stop right away and call your team if you feel dizzy, short of breath, have chest pain, or notice new swelling. Those aren't things to push through. Once treatment winds down, rebuilding strength is its own process, and it's normal for it to take longer than you'd like. Exercise guidelines for survivors generally point toward working up to about 150 minutes a week of moderate aerobic activity, like brisk walking or cycling, plus resistance training 2 or 3 times a week for major muscle groups. The key word is gradually. Start light, add a little at a time, and let your body set the pace rather than your calendar. If you had bone-related side effects, neuropathy, or surgery, a physical therapist or a certified cancer exercise specialist can help you build a plan that fits your specific situation safely. That referral is worth asking for, and it's one I wish more of my own patients knew to request. Movement through cancer isn't about bouncing back to who you were before. It's about giving your body small, safe reasons to feel a little stronger each week. Some days that's a walk around the block. Some days it's stretching in a chair. Both count. And if there's one thing to ask your care team about today, make it a referral to a physical therapist or certified oncology exercise specialist. They can build a plan around your specific side effects, and most people never think to ask. Sources and more resources are linked below and on my site. Take care of yourself out there. I'll see you in the next one.